Hi everyone. Uh, Today, what we are going to ask to my uh, my friend, my friend Matt is um, affordable health care for everyone through Premonition Health. Have you been looking for medical care and you don't have insurance and you are having kind of trouble to go through your insurance to get the care that you need and you want? So that is what we are going to be doing today with Matt Besson. Nice to see you.
Nice to see you too.
Yes. I met Besson about a month ago and 1 million cups. And I saw his proposition of the practice that he does, and I really like it. And I became his patient, and also my husband. Why? Because it was so difficult for us to find a doctor for a year that we could feel comfortable with, um, because uh, most of the time it's really difficult for everyone to get an insurance that is affordable and also to be comfortable with the doctor practice. That is one of the things that are more difficult because most of the time we get like 15 minutes, 15 minutes, and sometimes we exchange doctors like from one visit to another. And so that is why I choose him to be my doctor. So now let's meet him and know a little bit more about who is Matt Benson. Okay? Um, how did you become a doctor?
All right, great question. So when I was in high school, my biology teacher actually told me I liked it. I was like, that sounds really interesting. I was a hospital volunteer in high school, and I actually was on the fence between being a fighter pilot and a doctor. And so I went to the Air Force Academy, and that things became very clear over the course of that year that I was probably going to be better at stitching people up than blowing them up. And so I left the Air Force Academy, went to med school, and actually came back to the Air Force for another 8 years. So the last 5 years in San Antonio, and as well as a brief stint in Afghanistan spot. And I do internal medicine, and I absolutely love it because it's a difference in people's lives.
That's really great. Um, my son is in the military, so I really appreciate that you become a doctor through that way. Um, and it's really meaningful because we are supporters of the military. And what is your specialty?
So my specialty is internal medicine. People call us internists. People don't know what that means.
Exactly.
What is an intern? Is an intern? It's not an intern. It's your first year of training after med school. An internist or internal medicine doctor is a specialist in adult medicine. So that's our job is to specialize in everything from 17 or 18 years old all the way to the end of training, just like a pediatrician specialist in children. And so we train a lot of time in the hospital, but also with multiple subspecialists. So like cardiology, nephrology, pulmonology, and we get very in-depth training in these specialties. So the idea is we're kind of like a super primary care doctor specifically for adults and often for sick adults. So if you're relatively healthy, family practice is a fantastic option. They do great work. When people get a little sicker or a little older, they usually tend to move over to internal medicine to manage more of this chronic.
That's great. What motivates you to start your private practice, and when did you start?
Great question. So I started a few months ago in May. I have been toying with the idea of starting my private practice for years and years. I did work with Denver Health when I was in med school, which is a safety net hospital system that focuses primarily on underserved communities. And I absolutely love taking care of people because I felt like I could really make a difference in their lives. And that a lot of people in these communities that didn't have a lot. And I joined the military, and the whole time I've been there, I've been thinking about this, kind of tossing around this idea of like, how do I get back to this? How do I do it? And my wife's so much taught, so we kind of had this unique opportunity to move back home and be close to home, but also come to an area that's kind of a doctor desert. There's not a whole lot of doctors, especially here on the south side of Wichita. And so I thought it was a really cool opportunity for me to start a practice and see if I could do something a little bit different to provide care to people that I really want to serve, but also survive financially, which is one of the big things we've been struggling with. So,
yes. Who will benefit from the services you provide on your practice?
I think most people, honestly. One of the things that we kind of pride ourselves on here, and that I think is unique to what I call concierge medicine or direct care, depending on which version, is that it's like having a doctor. Right? My family does this to me all the time. They call me up and they're like, "Hey, I burned myself on this, or this thing stung me, or I'm having trouble with X, Y, or Z." And I get on the phone, I can help them out and send a prescription, and usually they're doing just fine. And that's kind of the beauty of this model, is that rather than being on a hamster wheel of like, I need you to come back in a month, I need you to come back in a month, I need you to come back in a month, we're not really bound to that. So for most people, you can call me whenever you need.
Can you be a little bit more specific? How do you work it?
Yes.
How do you have it structured for us as patients?
100%. And I did not originate this idea, so I'll say that. As much as I would love to like take credit for it, the practice model we're using came long before I came around. We do a combination of two things. One of them is called direct care, which is for people that either don't have insurance or don't want to use their insurance. And for that, we charge a monthly fee, and that's it. That's you pay a monthly fee, and if you come in once or you come in 5 times, you charge the same amount. We're a little bit unique. A lot of the direct care places will bill you based on your age, and so the older you get, the more you pay. At Premonition Health, because I understand that your age doesn't necessarily correlate with your healthcare needs, I do it more based on how much you need. So if you're needing me only 3 or 4 times a year, you're going to stay at that lower rate. For people that need me more than that, I'll increase their rate, but I can still see them as much as they need. And the idea for that is I want to both reward you as a patient for not needing as much care, but also give you the flexibility that if you do.
And are you specific? Are there any specific age group or demographics that you focus on, or that particularly benefit from your care?
That's a great question. So we treat anyone 17 and up, usually 18 and up. But I think in particular that the groups that benefit the most from internal medicine doctor are people who have chronic illnesses, right? So if you have heart problems, liver problems, autoimmune disease, kidney disease, right? Diabetes, these are the things that we really shine at. And also particularly people who are over 65. That's another big one for us, is when as you tend to age, you need things a little bit different, and in turn it's really shine for the over 65 population.
And what types of services and treatments do you offer in your practice?
So it's a great question. We do all primary care things. So we, office visits, obviously we'll send prescriptions and everything like that. We are setting up a contract right now so that we can do some radiology studies here in-house. We have a mobile imaging service come by. They can do x-rays here. They can do ultrasounds here in our clinic. We are working on getting lab draws here as well. But for the meantime being, we send people off to a contracted area outside. But one of the things we've negotiated is for our cash pay patients, we have steeply discounted rates for labs, which is nice because that's a really big area to save money.
And also, I think you told me that you do EKG.
We do. We do EKG, breathing treatments, injection, sutures. Like we could do most things that an urgent care.
And everything under one price.
All under one price. Yes, I don't charge extra. If if you need me on a Saturday or a night, something we can take care of, I'll just count that as one of your visits.
That is a wonderful thing to have, like a resource for anyone that is having trouble to find health insurance, or they don't have nobody that take care of their health.
What I tell people is
Mhm.
one trip to the urgent care for most people is around $600 to $800, and that's how much I cost for the entire. Right, so if it's something, if it's the thing that you're using often, you're like, I need to go to the urgent care because I don't have anywhere else to go. If you pay for a membership, you may not even need urgent care, so you can trust that, and then you also get the benefits of having a doctor.
And that is really great because, when you go to a regular doctor, they say, okay, now you come back for the lab results. It's another cost that you have to handle. And I remember that last one you told me and told my husband to give us exactly the instructions that we were going to do and our prescriptions, and it was really nice.
The idea, right? The goal is really to keep you from having to come back, but also the flexibility to call me, you can text me, and then we try to get back to you quickly. Take care of.
Mhm. And that is something that I really got my attention. Okay, and now we are going to talk about specifically a community that I'm part of, and this is the Hispanic community. How you can help the Hispanic community in your practice? Because most of us has trouble because we don't speak English or we don't understand it there. So that is the first invitation we will. And then I'm in a movement that is called Accessible, that is fighting to integrate, professional interpreters in the medical field, because it's really important for me to see that this is kind of something that has to be done in every single place. So, talk me about that a little bit about what you offer for this time.
So I'm gonna preface this with although I understand a decent amount. I actually speak French better than Spanish, which is kind of funny, but I love taking care of kids, right? My mom's actually an immigrant. She came from Canada, so that's a little bit of a different story, right? Not the same story from Central and South America, but I love it, right? I think it's really fun to be able to help people get the care that they need. Because often that language barrier, especially in a 15-minute appointment, is almost impossible to reach. I practiced in San Antonio for 5 years, so a ton of my patients spoke Spanish. When we had migrants coming through where they were found in buses and stuff, I got to take care of them in the hospital, which is really a great experience. So I love being able to take care of people. One of the things we're working on to specifically help that is having translators in-house, right? Which is, I think, a combination of phone interpreters or in-person interpreters. We don't add additional charge for that because I think it's important to be able to get your healthcare at a reasonable price. And we're working on what exactly that's going to look like. That's probably a combination of sometimes you have people and sometimes you have a phone, but regardless, we have people there so that if I got Spanish, people from the
That is what also got my attention, because you have a vision that includes the Hispanic community, and that is really great, and I really appreciate it. So, what can a new patient expect in their first visit, and how should they prepare for their consultation?
That's a great question. You know this because you just said it. But what I usually tell people is have records, all of your records. If you have medicines or supplements or anything, literally just put them all in a bag and bring them. That's like the best thing you can do is bring all of the medicines you've taken, including stuff you've taken in the past. If you don't remember, grab those bottles and throw them into. Bring in your records. We send out a form ahead of time where you can fill out your medical history, and that speed things up a bit. But usually I tell people to count on at least an hour or two for that intake visit. Spend quite a while going through your history at length. And I think that's part of good healthcare, right? I really want to know you
Uh-huh.
and know where you're coming from and where you've been and what we've done so far, because that helps me treat you better. So I usually you don't get an hour to 2 hour appointment at the start. We do that every time for our new patients.
Mhm.
Not all appointments will be that long, I promise. But the beginning is I like to spend time with people so they get to.
Yeah, and that is one of the things that has been lost with time because the big hospitals and clinics ask the doctor to see a patient 15 minutes only, or between 15 to 20 minutes. So, and that is not possible to follow up and do the right treatment. So, I really appreciate that too. And another thing that is a big concern or something that people is looking is how do you handle patients who may have unique or non-traditional health needs? Like, for example, me, in my personal experience, I was looking a person that will understand that I am doing like alternative medicine and not traditional medicine.
Yes.
And I wanted someone in my team that understand this approach because sometimes the doctors doesn't want to, the ones that are practicing traditional medicine doesn't accept very well the concept of alternative medicine. How did you do this over here?
Yeah, and so I think that's a great question, right? So
Uh-huh.
we call all Western medicine or traditional medicine. Um, you tend to have very specific rules, right? We have to do studies and we tend to use prescription medications for the most part, and it's probably really hard to have. There's lots of other ways to do medicine, right? I lived in Japan for a few years. Campo is a really big thing there. It's an herbal medicine. They have 200 or 300 different varieties. They can ask you questions. They're like, you get 193, and it works. They actually have information that this stuff helps. And I think that recognizing that most of the drugs we have came from plants is an important thing, right? Like I think that herbal medicine has a role, right? And the biggest thing that I can do as a traditional doctor is make sure that I'm working with you as you're trying supplements or doing other things to avoid things that will cause, right? Because I'm not a naturopath. I don't understand, have the training, like try this herb, try this thing. But what I can do is say, I know that you're on these medications, I know you're on these supplements. Let's make sure we adjust these so we're not causing a bad interaction, causing harm as you're working with people. And I think that to me, that's the best way to complement it because people have different needs, and I've seen people have good responses in areas that I don't frankly understand, but it works. And then, so I don't, in those cases, I'm like, great, if this is working for you, not causing harm, we're going to find a way to make this work for everyone.
Yeah, and besides, you are part of the team because, as I tell you, most of the time, these people, or like me, we have a functional doctor that works together with the specialist and the family doctor. And it's really important just to know that you have to have a team in order to keep up with your good health.
Yes, and medicine is definitely a team sport. That's what I tell people all the time. I'm like, I don't do everything, right? And I'm not supposed to. I don't understand. That's really one of the areas where we pride ourselves and trying to work with your various teams to make sure we're all.
Okay. Thank you so much for all this learning time about what Premonition Health can help us as community. And now, where are you looking? How people can get to you?
Yes.
How they can make an appointment?
Of course. Oh, thank you for asking. So we are just of such a big distance or we'll behind Harry Street at 1431 South Bluffview Drive. We're Suite 210. So if you see the big red awning from Bluffview, you come right through the awning, and your first door on the left is our office. An office number 6789-6049. It's available 24/7. So during the day, it will come here to our office, and it will come through to me or to another answering team, and we'll make sure someone's here to take care of stuff. Back. You can also text it like that. We have an email address, info@premonition.health, and a website that's www.premonition.health. For all my patients, I always recommend doing an initial consult, which is free. You can sign up for that on the website. There's a button that says schedule a free consult. And that way you can sit down and talk with me and make sure that we're going to be a good fit. It's something workable. It's not everybody, I think it's important for people to come with their eyes open and understand what's going to happen or not happen and how we're going to get this working. I think it's an opportunity in a stress, zero pressure environment to talk about this is what we offer. If this looks like a good fit for you, then we'll set up that bigger, longer initial appointment. And the other place you can find us is actually on insurance website. So we do take some forms of insurance. For Prudential with Aetna, we're working on United and a few other ones right now. So as those come on board, we'll also be listed.
Okay. Well, now you have a resource over here about, your medical care, and that is really a great one that you could come over here and figure it out if it's a right fit for you. Follow his page, Premonition Health, in Facebook
And Instagram.
and
You're on
Instagram.
Instagram.
And Instagram. Yeah. Follow also Las Aventuras de Araceli to get more informed about different opportunities that you may have and resources in Wichita. Bye bye. Thank you.